Pressure Ulcer Development and Nursing Prevention in the Geriatric Population by Nikisha, Jennifer, Jenny, Jeannie, and Kathleen. A pressure ulcer is a localized injury to the skin and/or underlying tissue, usually over a bony prominence, as a result of pressure or pressure in combination with shear. This can extend the average hospital stay for a patient from 5 to 14 days. 56.5% of older adults over the age of 65 in hospitals develop pressure ulcers, and 54% of hospitalized patients are discharged to long-term care facilities with pressure ulcers. Some of the causes of pressure ulcers are spinal cord injuries, nutrition, peripheral vascular disease, and incontinence. One way that you can prevent pressure ulcers is through proper positioning, and throughout our presentation we will discuss these issues. Spinal cord injuries affect the spine that fractures or dislocates vertebrae. The damage crushes and destroys nerve cells that carry signals up and down the spinal cord between the brain and the rest of the body, and can result in complete paralysis. This can cause major problems for the skin and can lead to pressure ulcers. There are many risk factors that can lead to pressure ulcers. Paralysis and sensory impairment, which affects the way you would normally feel. Muscle atrophy, which is shrinking of the muscles, which means less padding around bony prominences. Altered circulation, reducing blood supply, as this can slow the healing of ulcers as well. And other health illnesses like diabetes that can cause slow healing. Lack of social support, not having someone to help with activities of daily living, along with smoking, substance abuse, and malnutrition. Research studies have estimated that in the United States, between 50% and 80% of persons with spinal cord injuries develop a pressure ulcer at least once in their life. The causes range from long-term periods of low or recurrent pressure. 1 to 6 hours of constant low pressure can cause tissue damage to the skin. Short periods of high pressure, such as hitting an area of the skin against a surface, causing damage. Shearing and positioning, dragging the skin across a surface and abnormal positioning can damage the skin as well. Skin moisture. Any skin that is exposed to moisture can become macerated and vulnerable to breakdown. Incontinence and sweating are two main problems that spinal cord injury patients struggle to maintain and are very likely the cause of pressure ulcers and skin breakdown. The skin must be constantly managed daily. Preventative strategies included checking skin twice daily. When laying in the bed, the person should be turned every 2 hours. Weight should be shifted while seated every 15 to 30 minutes to allow blood flow to those areas of pressure. Using chair cushions in wheelchairs may help relieve pressure to areas prone to breakdown, and continuous management of incontinence and nutrition is necessary. Education is a key factor. Knowing and understanding each of these areas will help to keep the skin healthy as long as possible or help prevent pressure ulcers from worsening. If a pressure ulcer were to develop, it is imperative to care for it properly because after a pressure ulcer develops, it can be very difficult to heal. In order to heal pressure ulcers effectively, no pressure should be on the area of concern. Maintaining a high protein, high calorie diet and increasing fluid intake of mostly water will also help. The pressure area needs to remain clean and dry, which may include more frequent changing of clothes and incontinence pads. If wounds have developed, there has to be adequate wound management from healthcare providers. The patient and caregiver need proper education, and they have to be willing to learn and understand the importance of caring for ulcers and the consequences of not caring for them properly. If the patient is not willing to do whatever is needed for adequate healing, the wound can worsen and cause life-threatening problems that can affect the rest of their life. Spinal cord injuries can be very devastating and hard for a person to deal with the sudden physical changes. As nurses, we need to be sensitive to the fact that patients may not be receptive to what is taught. Discussions can be difficult, but imperative to the proper care of patients with spinal cord injuries. Skin is one main important system in the body that needs to be protected from breakdown. Pressure ulcers can be preventable, and education is the key. Nutrition also affects pressure ulcer development. Good nutrition is essential for health and plays an important role in preventing pressure ulcers and promoting wound healing. Some of the factors related to pressure ulcer development are malnutrition and inadequate fluid intake. Malnutrition impairs the collagen synthesis, which decreases the strength of the skin. Malnutrition also impairs the immune system, which puts the patient at risk of infection. It also slows wound healing. Inadequate fluid intake affects the patient because this causes dehydration. Dehydration disrupts cell metabolism and affects wound healing. It also decreases blood flow to the tissue, which causes it to break down. Drying of skin can also lead to injury. Peripheral vascular disease is a chronic limb ischemia caused by atherosclerosis of the peripheral arteries. Diabetes is a risk factor for this disease. The most common symptom of peripheral vascular disease is muscle pain in the lower limbs on exercise. In diabetes, pain perception may be blunted by the presence of peripheral neuropathy. Therefore, a patient with diabetes and peripheral vascular disease is more likely to present with an ischemic ulcer or gangrene than a patient without diabetes. The use of ankle brachial pressure index in the clinic and bedside provide a measure of blood flow to the ankle. This could help early detection, initiate early therapy, and may thus reduce the risk of critical limb ischemia and limb loss. Peripheral vascular disease serves as another example of the need to live as healthy a life as possible. At least a patient with peripheral vascular disease should make every effort not to smoke and to engage in an appropriate physician-approved exercise program. Here is a list of nationally recognized health promotion programs for older adults from Chapter 7 in our text. Incontinence. Skin and tissue damage related to pressure ulcers is related to factors such as penetration of excess water in the skin, turgor changes, increasing friction, and the permeability of irritants such as those of digestive enzymes. The proper ways to reduce skin breakdown due to incontinence is to cleanse the skin appropriately after each episode using a pH-balanced perennial cleanser. It is also important to avoid vigorous cleansing of the skin, as this can break down skin. Apply incontinence barriers such as creams, ointments, and pastes. Avoid the use of briefs because when a patient wets those and they're not changed in a timely manner, this can cause moisture to build up on the skin. And also consider using an external containment system when appropriate, or internal, such as a condom catheter or Foley, but also keep in mind that these do cause infection. Repositioning. Peripheral pressure ulcers affect an estimated 3 million adults, and the total treatment cost in the U.S. has surpassed $11 billion per year. The 2006 cost of treatment for full thickness pressure ulcers was $70,000. According to our text, the key is to distribute the load over contact areas of the human body to reduce overall pressure and avoid areas of focal pressure. SOC is to reposition a patient every 2 hours. However, every 4 hours with the use of pressure distribution mattresses may be adequate. SOC stands for Standard of Care. Turning versus pressure has been taught in nursing textbooks and studies conducted since 1978, but was spoken about as early as Florence Nightingale's times. No one is really sure where the idea for 2 hours came from, but maybe how long it took nurses to walk up and down an aisle of patients if we are talking as early as Florence Nightingale. Recommendations for positioning include a 30-degree tilt and using transfer aids to reduce shear and friction. The PPS was more efficient by needing less nurses or staff and took less time away from other nursing duties. This would also reduce the risk of nurse injuries. The PPS was more effective at obtaining the desired degree of angle, and it was able to be maintained better by using foam wedged for the shoulder and hip areas. The standard of care using pillows is inadequate due to the low degree of tilt obtained and maintained. Pillows flatten over time and are unable to maintain their shape. In conclusion, pressure ulcers developed due to many causative factors like incontinence, spinal cord injuries, improper skin care, poor nutrition, peripheral vascular disease, and an identified patient at risk who is not being repositioned every 2 hours. This has been an ongoing health care problem, especially for our geriatric population. Pressure ulcers that are acquired during hospitalization or in a long-term care facility are indicative of poor care and can lead to a decline in health, infection, loss of limbs, and sometimes even death. There are many techniques that can prevent the risk of pressure ulcer development from occurring, such as keeping the skin moisturized, consulting a dietitian, encouraging activities to enhance circulation, and turning at-risk patients every 2 hours. The purpose of our presentation was to review some of the major causes of pressure ulcers and prevention measures, including the option of using a patient positioning system. We hope that you learned something from our presentation.